You have a 22-year-old woman who presents with lower abdominal pain, a positive pregnancy test, and vaginal bleeding. What's the most likely diagnosis? 22-year-old woman presents with lower abdominal pain, positive pregnancy tests, vaginal bleeding. What's the most likely diagnosis? This looks very simple, right? Looks like everyone wants B. Okay, so why B? Why is the answer is sure B? Why is it B? And I'm going to explain as well why candidates flank that particular question. The combination of a positive pregnancy test, the pain, and vaginal bleeding strongly suggests ectopic pregnancy. Then somebody will say, why is it not appendicitis? Because it could be that the patient has appendicitis and the patient is also menstruating. Well, what about a positive pregnancy test? So I'll say PID. You remember the last time I was talking to you about how to formulate your differentials, and I'm going to have a whole lecture on that. How to use a systematic way to generate your differentials, and we're going to look at many examples. But yes, someone with PID can still be menstruating and they can still have abdominal pain. But as soon as you see this, the positive pregnancy test, what is more likely? Is it not ectopic pregnancy? And when patients have ectopic pregnancy, they can at times bleed as well. Now, why do candidates miss this? Candidates may overlook the bleeding and focus only on abdominal pain. So if they leave the bleeding side, they leave the positive pregnancy test, and they are focusing on only abdominal pain, then that is when they are going to think about appendicitis and ovarian torsion. But if you highlight the important clues like number one, positive pregnancy test in your exam, and vaginal bleeding, positive pregnancy test, vaginal bleeding in a female of reproductive age is ectopic positive pregnancy test, vaginal bleeding, abdominal pain. These three is ectopic pregnancy until proven otherwise. All right. So if you see this, that should then cause you to think, okay, what is actually going on?